Hello, and welcome to another day of Living with Spina Bifida. Today is Fitness Friday, and we are going to talk about inflammation. What's inflammation? If you don't have inflammation, then obviously you don't know what it is. But if you do have issues with inflammation, then you definitely know what it is. Inflammation is a process by which white blood cells and substances they produce protect us from infection with foreign organisms such as bacteria and viruses. However, in some diseases like arthritis, the body's defense system, the immune system, triggers an inflammatory response when there are no foreign invaders to fight off. In these diseases called autoimmune diseases, the body's normally protective immune system causes damage to its own tissues. The body responds as if normal tissues are infected or somehow abnormal. Some, but not all, types of arthritis are the result of misdirected inflammation. Arthritis is a general term that describes inflammation in the joints. So normally if you have inflammation, you have redness, swollen joints, sometimes are warm to the touch, joint pain, joint stiffness, loss of joint function, and sometimes inflammation is associated with general flu-like symptoms, including fever, chills, fatigue, loss of energy, headaches, loss of appetite, and muscle stiffness. When inflammation occurs, chemicals from the body's white blood cells are released into the blood or affected tissues to protect your body from foreign substances. This release of chemicals increases the blood flow to the area of injury or infection and may result in redness or warmth. Some of the chemicals cause a leak of fluid into the tissues, resulting in swelling. This protective process may stimulate nerves and cause pain. The increased number of cells and inflammatory substances within the joint cause irritation, swelling of the joint lining, and eventually wearing down of cartilage. There are ways to help treat or ease the pain of inflammatory issues, which are, if you go to a doctor, they can correct, control, or slow down the underlying disease process, or you can avoid or modify aggressive, strenuous activities that would aggravate your pain, relieve pain through pain medications and anti-inflammatory drugs, maintain joint movement and muscle strength through physical therapy, or decrease stress on the joints by using braces, splints, or canes as needed. Lastly, I'm going to talk about a few different kinds of foods you can put into your regular diet that could help reduce inflammation and pain issues. Foods that are high in sugar and saturated fat, though bad for every reason, can spur inflammation. They can make it worse. It can cause overactivity in the immune system, which can lead to joint pain, fatigue, and damage to the blood vessels. So just stay away from sugar and saturated fats. But there are foods that can help curb the inflammation and settle it down a little bit. Fatty fish, oily fish like salmon, mackerel, tuna, and sardines are high in omega-3 fatty acids, which have been shown to help reduce inflammation. Whole grains. Consuming most of your grains as whole grains, as opposed to refined white bread, cereal, rice, or pasta, can help keep the inflammation at bay. Dark leafy greens. Studies have suggested that vitamin E may play a key role in protecting the body from pro-inflammatory molecules. So spinach, kale, broccoli, and collard greens would be a good choice for you. Nuts. Nuts have another source of healthy fats that can help fight inflammation, particularly almonds and walnuts, though all nuts are particularly good for you. Soy has been shown in women to lower inflammation levels. Low-fat dairy. Milk products are sometimes considered a trigger food for inflammatory diseases like rheumatoid arthritis because some people have allergies or intolerances to casein, protein found in dairy. But for people who can tolerate it, low-fat dairy are an important source of nutrients. Yogurt can also contain probiotics, which can reduce gut inflammation. Peppers. Colorful vegetables are part of a healthier diet in general. Peppers, however, are nightshade vegetables, which some doctors and patients believe can exacerbate inflammation in people with rheumatoid arthritis. Tomatoes, another nightshade vegetable, may also help reduce inflammation in some people. Beets, along with fighting inflammation, have been shown to protect against cancer and heart disease. Ginger and turmeric, garlic and onions. Garlic has even been shown to work similarly to pain medication, like ibuprofen. Olive oil. Anything that fits into a heart-healthy diet is probably also good for inflammation. Berries. All fruit can help fight inflammation, but berries especially have been shown to have anti-inflammatory properties. Tart cherries. Research has shown that tart cherries have the highest anti-inflammatory content of any food. Unfortunately, I myself am deathly allergic to them, so no tart cherries for me. So there you have it. I hope some of this has helped you, and possibly you could get a little extra relief from your pain, from your arthritis inflammatory issues.